All right. So last time we got far, but not far enough. Not as far as I want to go. So what I'm gonna do is I'm actually going to switch and make the recordings a little bit longer, more closer to the first video, because these the shorter videos, even though they're good in terms of watching, because you can have the choice to just watch a little bit of it and then walk away. The problem is that it just takes so long to just get through one lesson. So we're gonna just go a little faster. All right. So last time we were actually talking about include and exclude, and we did a few things, and pretty much was very simple idea to understand. So let's move on. Now these two items here, other and unspecified. All right. We have to be very careful when you see these two notations. When you talk about something that's other, it simply means the information that's provided um, cannot match whatever it is that you have. So really similar to not elsewhere classified. Alright, so it means that the information that was provided to you cannot be found in the book. Alright. Whereas unspecified means that information was not provided to you. Alright, so two very different distinctions that make sure you understand the difference between the two. Alright. Now, so as far as the book goes, the way the book categorized disease and outcome is through etiology and manifestation. All right, so basically the cause and effect. All right, so etiology is the underlying disease, manifestation is the outcome of the disease. So a good example that I always use is diabetes. Let's say, for instance, you have a patient who's diabetic. So as a result of diabetes, the patient develops some sort of neurological disease. So basically, the diabetes will be the etiology, the neurological disease will be the manifestation. So that would be the outcome. When it comes to sequencing this sort of code, you always sequence the underlying disease first. Right, so as it says, you always code underlying disease first, then manifestation. That's exactly what you do. You code the diabetes first, followed by the underlying, followed by the manifestation. Oftentimes, too, what you're going to find is you're going to find codes that will say something to the effect of in disease classified elsewhere. Whenever you have anything that says in disease classified elsewhere, that means this code cannot ever be used by itself, nor can it be used first as a primary code. The reason that code is in the book is because it is a disease that is associated with another underlying disease. That means you have to code the underlying disease first before you can code anything that says in disease classified elsewhere. Alright, so never ever code disease classified elsewhere as a primary code. Right? It is there because it is used to serve the purpose of a disease elsewhere. So going back to the diabetes and the neurological manifestation, for instance, you may have a neurological manifestation code, but that code is specifically being used for a diabetic. That means you cannot code that neurological manifestation code without actually first having to code the diabetes code. So that's how that will work. And then here are some more notations: N with C and C also. In the book, N can be used as both N and or, and with can also be used as something that's associated with or something that's due to. So don't just take them for their face value as and with. They can be used for more than that. Whenever you have a C in your notation, C simply means you need to go see another term for reference. For instance, in the book, oftentimes what you're going to have is you may have something that says C, let's say I give you a code to find, and it says go find a fracture of the tibia. And the first thing you do is you go to the word tibia because, well, maybe that's what just comes to your head. So that you see tibia and you go to tibia. Well, tibia is the body part, right? So tibia is the organ site, anatomical site. When you go to tibia, what tibia is going to say is go see condition, or simply see condition, because the book is not going to list every single disease that could be affected by that could affect the tibia, because then the book will not be what you see. It will be much bigger than what you see. So it's much easier for you to find fracture, and then after fracture you find tibia. It is much easier to keep track of something like that. than to have each individual body part have all the diseases that could affect it. It just wouldn't. It would be a nightmare. It wouldn't work well. So the other one is C also. C also is more of an additional thing. So you don't have to always go see C also. C also is there as a way to help you out. Now, this is a bit of a review of what we did before. So before we said that there are 17 individual chapters in volume 1, and the code range from 001 all the way to 99 category. After you finish looking at the 99, then you have the V codes. In some of the older books, and in one of the book that I'm actually using, in 2010, the V code only go up to V89. If you have a newer book, the V code will go up to V91. And vehicles, as we mentioned before, these are factors that influence your health status. Specifically, if you, let's say you want to go for a screening, you want to talk about somebody's history, you want to talk about a pre-operative exam or even a post-operative exam. All these are situations where the individual may not necessarily be sick, or the reason the person is there for the visitation may not have to do with the actual sickness. So these are situations, these describe the situations where you can talk about a person, because the person still needs to be coded for each visitation, for each encounter. So that's why we have these encounter codes. And then you have the E codes. The E codes are explanations for all the external cause of injuries and poisons. And then we have the 5 appendices. All right. A is morphology. All right. So this keeps a statistical data of all the neoplasms, cancers. And then we have appendix B. Appendix B has been deleted. And then we have appendix C. Um, Appendix C is keeps the classification of drugs. Appendix D for drugs and chemicals. I'm sorry. I'm so used to saying drugs and chemicals when I would say D, but no. Appendix D is for industrial accidents, and then finally Appendix E will give you all the list of the 3-digit categories. So more on Appendix A. Again, Appendix A morphology. All right. Morphology, just the medical term, study of the form, in this case, form and structure of a neoplasm. WHO keeps track of all the diseases with ICDO, oncology. Right? So they keep track of all the cancers. And so as I said before, if you're a coder, you may not necessarily be putting down morphology codes. This is something that's done by the cancer registrars. Right? And as I mentioned already, appendix B for mental disorders, C for the classification of drugs mainly used by pharmacies, and we have appendix D, industrial accidents, and then appendix E, all the 3-digit categories. All right, so that is the content of the book. All right, 17 main chapters, and now let's get into a bit more of coding. So whenever you have a situation where you have a disease, let's say we have pain, the individual has chronic pain and the individual also has acute pain. What you do is that you can sequence both codes. But what you have to do though is that you have to sequence the acute pain first, right? So the acute disease is always coded as first. Now, there are certain codes in the book that have what we call combination codes, right? That simply means that you have a code that contains, let's say, both the underlying disease and its manifestation, or it can be the disease and the cause of the disease, meaning, let's say, staphylococcus caused a some sort of infection. So then you will have the infection caused by staphylococcus all in one code. So here you basically killing 2 birds with 1 stone. So you have both codes are already combined, or both parts of the code and combined into 1 code. So you don't have to go code staphylococcus as 1 separate code, and then also code that infection as another code. So you don't need 2 individual codes because both codes are combined into 1 to give you 1 code. Hope that makes sense. That's pretty much all the combination code is. Right. Now, when it comes to coding, and I will get more into signs and symptoms when we get into chapter 16 coding. But essentially, a sign and a symptom um, are part of the disease process. That means that if you have pneumonia, right? You go to the doctor's office or you go to the hospital, you present with cough and fever. Obviously, you know what a fever is. That's when your body temperature has risen. So you may have even measured yourself at home, and now you know that you have a fever. You're coughing. Obviously, you know that you're coughing. Now, when you present to the doctor's office or the clinic, these are your signs and symptoms: the cough and the fever. Now, if the physician in a doctor's office is not able to diagnose you and simply sends you home, then all they can diagnose you with, or all they can write down, is cough and fever, because there was no definitive diagnosis. However, if they do diagnose you with pneumonia, at this point there is no reason to code the cough and the fever, because cough and fever are integral. All right, these are part of the disease process for pneumonia. Therefore, you don't need to code them separately. So you don't need to code cough, fever, and then also code pneumonia. It's unnecessary. All right. So that's what is meant by things that are integral part of the integral to the disease process. Right. So if fever and cough are part of the disease process for, let's say, pneumonia. Another example is something like UTI, urinary tract infection. Individuals with urinary tract infection typically will have painful urination. Um, so if the person comes to the doctor's office and the person has painful urination, and then a blood test, urine test is done, or blood test can be done too, but let's say urine test is done, and as a result, they find out that the person has urinary tract infection. Well, the reason the person had the pain cannot be concluded as part of the UTI, the infection. So at this point, there's no need to code the painful urination. So that's how that works, right? So any condition that is not commonly associated with the disease, of course, you can code that separately. So for instance, the person came with fever and cough. Well, dehydration is not typical of pneumonia. So what you can do is you can code it separately, right? Even though dehydration can occur as a result of pneumonia, it's not so common that you are prevented from coding it. Whereas cough and fever, it is it's essentially um, what you get when you have pneumonia. Now, there is also something that you need to be aware of. It's called a late effect. So, a perfect example, let's say an individual had a stroke, maybe last year, or maybe even 10 years ago, even 20 years ago. The stroke is obviously not present now. It was 20 years ago, if you use the 20 years as the example. Now, in present day today, the person has difficulty swallowing. Well, the difficulty swallowing is the present disease, and we call it the residual. So you cannot code the stroke as a present disease. So if I wanted to find stroke and I went under S and I look for stroke, I'll be doing it incorrectly, because what I'm doing, it will be incorrect, right? What I'm doing is I'm trying to find stroke, meaning the person currently has stroke. But that's not the case. The person had stroke 20 years ago, right? So therefore, we're going to code the stroke as a late effect, right? We're coding the stroke as a late effect. So let's see here. A residual affects after the acute phase has terminated, right? So the residual will be the difficulty swallowing. Now, as far as the late effect goes, it's important to know that there is no time limit. So it could be yesterday, it can be 2 days ago, it can be 100 years. Well, realistically, probably might not be 100 years ago. It could happen, but essentially, there is no time limit, right? Some of the key terms that you may be looking for are things like old residual sequela. Alright, so those are some of the key terms that you want to look for. You just have to keep in mind that this is not the same as a history of. So you don't code it as a history of, you code it as a residual. Like a history is something that has been eradicated, essentially, something that no longer can have an effect on the individual's present condition. Um, Now, what you have to do is you have to code the condition or the nature that led to the late effect first. All right, you have to code the condition or the nature that led to the late effect, and then you code the late effect second, the actual late effect code. All right, so you will not be looking for a stroke under S. You will be looking for it under L, late effect, literally late effect. All right, and again, do not code the acute phase because the acute phase is not here. So let's say we had a late effect of acute poliomyelitis. Um, the acute phase of poliomyelitis is 138. The acute disease code itself is 045 XX. Right. So the person has ABC 10 years ago after the acute phase has left, and that's how you will structure that code. Right? When somebody says something is impending, that means it's not a current disease. That means you do not code it as the current disease. So if let's say if it says something like impending pneumonia or impending hypertension, you cannot just go under pneumonia and simply code pneumonia, or go under hypertension and code hypertension. What you could code is you could look under impending or the word threatened, on the alphabetical index and try to see if there's one that is located underneath it. Right. Now, reporting the same diagnosis more than once, there is no such thing, so you don't have to worry about that. All right. So, what do you do when a person has admission for an encounter, specifically for a rehab? All right. What you have to do is you have to code the purpose of the encounter, if it's rehab. All right. You sequence the rehab first and then the diagnosis. All right. And if it so happens that the encounters for more than one type of rehab, then you can use a V57.89 code. All right. But just keep in mind, if the encounter is for rehab, you sequence rehab first and then the diagnosis. Right. Now, BMI, body mass index, and pressure ulcer stages, these are some of the few exceptions to medical records. Right. Typically speaking, in order for you to code certain things, you definitely need to have the documentation for it. However, when it comes to BMI and pressure ulcers, right, you can report these codes based on records from the clinicians other than the patient's provider. So if you have this information from somebody else who is not specifically the person that you code in your records from, it's fine, right? Right? But if there is any associated diagnosis, it must be documented from the provider, right? The obesity, pressure ulcers, again, these are some of the items that you definitely want to keep an eye on, right? So if it's obesity or pressure ulcer itself, you cannot simply go ahead and code it unless it is from the provider. However, if it's BMI or the stage, right? If it's BMI or the stage of the ulcer, then you can go ahead and code it. So let's say, for instance, we have a Dr. A. Right? Dr. A has in the medical record that a patient has pressure ulcer or decubitus ulcer, but he doesn't list the stage itself. Patient goes to see Dr. B. Right? Dr. B lists the stage of the ulcer. So even though you code in the record from Dr. B now, and Dr. B is not the primary provider for this patient, you can still use the stage because it connects to Dr. A's pressure ulcer. Right? And one of the main reasons here is because it's not going to affect much in terms of coding. It's only going to be used as a secondary diagnosis. Right? And just a few items to that students usually run into problems with. Sometimes you may look at a word in the alphabetical index. When you go to confirm the disease, it doesn't say exactly the same thing. Right? So be careful with those. Don't be afraid when you see that.